now, and it's pretty exciting. So
yeah, that's great. Let's talk about that too, because this does have a rich history. I'll ask you that about the first question. Give us a little bit of a history of IMMH and where it's come, and like now where we are here. That'll be wonderful. Perfect. All right, I'm going to put the YouTube streaming on now, and at 5 o'clock you'll see the intro come up, and then it'll be obvious when to turn the screen back on. Thank you. And then it'll be obvious when to turn the screen back on. Thank you.
Thanks so much, everyone, for watching. We've got an epic lineup tonight of speakers. We've got an awesome panel here. Amazing group of functional doctors, technology, activists for a leap forward in medicine.
You know, our goal is to make it easy for practitioners to learn in community.
This ecosystem that is being set up by the meetup groups, we believe will be the future ecosystem of this evolved primary care network, and it all revolves around you.
Welcome to the Functional Forum. Thanks for joining us in the charge to accelerate the evolution of medicine. Please welcome your host, James Maskell.
Hello, everyone. Here we are. It's the Functional Forum. It's our September episode, and we couldn't be more excited with the lineup that we have tonight and everything that we are going to get into. If you are passionate and interested about the future of mental health, you are in the right place. This session tonight serves as a preview for an upcoming conference called Integrative Medicine for Mental Health. We've got some of the speakers from that event. We're going to showcase some of the innovation happening at that event, and we're super grateful to have you here with us. Just a couple of notes before we start. We are live, so you can ask questions. We've got an incredible panel here tonight. We've got some of the leading experts in brain health, Alzheimer's and dementia, precision medicine, integrative mental health available for you. And if you have a burning question, you go to X or Twitter. You can use hashtag functional forum. I'll be monitoring it, and towards the end, and maybe all the way through, we'll take questions. I'm really glad that you are here with us, especially if you're in one of the communities around the country. Really grateful for all of the communities that get together to learn together in community. And so if you're in one of those communities, a special warm welcome. As we said in the intro, the purpose of the Functional Forum was to make it easy for people to learn in community. That can be happen locally. That can be happening at conferences like Integrative Medicine for Mental Health. Here are just some of the details. We'll get into all the speakers and all of that a little bit later, but it's coming up October 10th to 13th. It's in Washington, D.C., and we'll have a little bit more then. So let's bring our speakers on. We have now Dr. Kat Toups is here with us. We have Dr. Sharon Hausman-Cohen, and we should have Emily Gutierrez here soon. Kat, it's wonderful to have you on here as one of probably the original functional medicine psychiatrists. You've been doing this for a long time. And I know over time, you have trended towards doing a lot more research and have been involved in many clinical trials. And I know 2 months ago, we had Dr. Christine Burke on talking about reversing Alzheimer's, and you're one of the other doctors in the different trial sites for that landmark study. And so we're super grateful to have you here. I understand that you used to go to this conference when it first began. So can you give us a little bit of history? Because it does have a unique place in the functional medicine ecosystem.
Yeah, well, I don't think I made the first 1 or 2 IMMH conferences, but it was pretty early on that I found it in my functional medicine journey. And it's always been an instrumental conference for me to start to put things together. With the connections between the body and the brain. So it was started by Great Plain Labs, and Dr. Bill Shaw, the head of Great Plain Labs, curated a few people to help teach us in the early days. And it's really exciting to see how it's grown into what we're going to be seeing this year, which is kind of, to me, the pinnacle of covering so many different aspects of psychiatry and mental health, and then the connections between the brain and the body, which none of us were taught in mental health, through our traditional training. So it's been quite an evolution, and to me, it's always my favorite conference of the year. I'm so happy that it's going to be live again. I find it's the size of it is large enough to be exciting, but small enough to be personal. You can have contact with the speakers and the exhibitors. They usually have an excellent exhibit hall where, especially people that are newer to this process can learn, like, where do you order this? Where do you test that? What supplements? Where do you find these good supplements? So I feel like it's a really wonderful opportunity educationally for people. And maybe we can talk about some of the specifics of the content, because
get into it. I know you mentioned earlier on that there are a number of, different sort of categories of content. So what are you most excited about? And maybe try and put yourself in the shoes of a psychiatrist who is coming around to the fact that there may be more causes to mental illness than they may think, and are looking for that sort of broad brushstrokes. What would they get at this conference?
Yeah, well, I believe Emily Gutierrez, who's going to be joining us, is going to cover some of the basics. And I know I've taught about that in previous years at IMMH. How do you come to this table as a functional medicine psychiatrist, therapist, nutritionist, health coach? Because we need all of those modalities of people to understand this. And so, one thing, I think this is an exciting conference, even for people that don't consider themselves mental health people, other people in functional and integrative medicine, to be able to put all the parts together and not leave out the brain, the emotions, the immune system, those kind of things, and how the immune system affects the brain. But what I really like about this year's conference, I've worked with my good friend Kirkland Newman, who's the organizer of the conference, to suggest that we try to have subtopics within the conference so that people can have a little deeper dive. It's one thing to have a nice interview, a nice talk where you say, wow, that's really exciting, but how do I do that? What do I do with it? So I feel like a lot of the information is hopefully going to be very clinically actionable for people, that they'll have a sense of what do I do next week when I get back to my practice. I made a list. I have to read them to remember them all, but some of the kind of sub-modules within this, the first one that's near and dear to my heart is a neurodegenerative module. As you mentioned, I do a lot of work with reversing dementia and cognitive decline these days. And so we're going to have a focus on that. And Dr. Bredesen will be with us. I'll be teaching about the implementation and, what I do in my clinical trials in my practice with that. And then we have, of course, Dr. Sharon Hausman-Cohen here, who's our wonderful genetics expert. We've used her genetics testing in our first cognitive decline reversal study, and we're using it again. And it's so exciting to see how they evolve and how this genetics becomes more and more clinically actionable for us. Used to be, okay, you have these genes, what do you do? But Sharon and her company and her research gives us the data. Well, how can you work around these? What are the epigenetic factors? So we're going to have all of that for our neurodegenerative module. There is a psychoneuroimmunology module. What is the interplay between the immune system and the nervous system? And how does that work with brain disorders and immune disorders? And what happens with autonomic dysregulation, which is just such a factor? And I should make a little plug because James is going to be doing his Vegas Fest at this conference again. And I was able to participate in that at the IFM meeting this past year. And it's an interactive module where you go through different stations and do different exercises. And I would encourage people to try to partake in that while they're in the conference, because it was very well done. I'm super excited about the metabolic psychiatry module. And so this is, using the ketogenic diet and working with shifting the brain into burning fats instead of burning sugar as fuel. And this is, to me, one of the most exciting innovations that we've had in psychiatry in my lifetime of more than 30 some odd years of practicing psychiatry. We thought the atypical antipsychotics were going to revolutionize what we did some time ago, and instead nobody gets better. And when I trained in psychiatry, we were trained with chronic mental illness like schizophrenia. A third get better, third stay the same, third get worse. But now nobody gets better in traditional psychiatry. It just, with chronic illness like schizophrenia. But enter in the ketogenic diet and metabolic psychiatry, and the way it changes the processing of energy in the brain, it's a miracle for some people. So we use that in our dementia reversal trials and work, and it's quite effective. But we're going to have some of the leading experts, Dr. Chris Palmer, Dr. Georgia Eade, are going to be here to teach us about that. So I'm very excited about that, and I encourage everybody who doesn't know about metabolic psychiatry to look at the benefits of that. And then there's just a couple more. There's so many modules within this conference. It's just a powerhouse of topics. We're going to, have topics on traditional psychiatry, depression, anxiety, ADHD, nutritional factors involving all of those things. There's a section on addiction psychiatry. And there's speakers on the psychedelic psychiatry, which is going to be another. It's evolving into another game-changing front for psychiatry and mental health. And finally, we're also going to have a couple speakers on hormones and the benefits of hormones in the brain, which are myriad. So all of these different aspects that were covered in this are things that I work with to reverse cognitive decline and also to reverse psychiatric illness in general. Excuse me, my voice.
Awesome. Can I ask you a question? So I was speaking to a psychologist last year. Yeah. Very interesting conversation, just conventional psychology, 40 psychologists that she was working with. And her theory or her feeling was that mental health was kind of like the new primary care, because the primary care doctor didn't have enough time to even listen. And the psychologist was sitting there listening to, often for an hour at a time and really understanding the person. And her feeling was that this should be where we should be deploying, these, holistic ideas, because ultimately, like, the primary care people, just don't have time to get into like the depth of knowledge. And I just thought that was such an interesting, take, because, here you are, with someone who's like ultimately not licensed to deliver on all of that, but is really like experiencing the full life of the patient. And I just wanted to get your thoughts on that, because I know there's psychiatrists that come, but there's all types of mental health professionals that come along as well, right?
Well, and so it's very interesting in my own evolution with this path of learning functional medicine. I just have to give you a little story. I remember so I was going through all the training at IFM, and then the module came up that was the cardiovascular module. And I said to my good friend and study partner, Mirto, I don't know about all this lipid stuff. Like, that's a bit far out for me as a psychiatrist. And Mirto looked at me and she said, Kat, you're not a psychiatrist anymore. You're a functional medicine doctor. And I got it. And so I went to the cardiovascular module, and it changed my life. And I use that every single day and every single patient, what is happening with that system. So I think the issue is, if we want to fix our brains, we have to fix our bodies and what's happening in our bodies, our immune system, and as well as our emotional system. So I just love it that more and more therapists, psychologists, nutritionists are getting how interrelated all of this stuff is, and coming to the table, because like most things with people that are, especially people that are chronically ill, we need a village to get people better. Psychiatrists can't do it on their own. Therapists can't do it on their own. So the more that I feel like we get all these different disciplines together and attack this, I think it's beautiful. And one of the things I've seen in my own community in the San Francisco Bay Area is, as some of the therapists learn about the benefits of functional medicine and precision medicine for mental health, they want to use it for their own well-being and their own healthcare. So that's a great place that, I know when I started training, I certainly was my own first patient with everything. And, it's a great place to learn. So I think that's a benefit of this conference, is how multidisciplinary the focus is.
That's a great introduction there. And Dr. Emily Gutierrez, so great to have you here. Neuronutrition Associates, a leader in the world of pediatric nutrition and reversing chronic brain issues in children. When I looked at the schedule, I saw that you actually sort of are laying a lot of the foundation for integrative and functional medicine in mental health. Can you give us a little piece as to why you think that the sort of the foundation of mental health should be integrative and functional medicine?
Well, it's the perfect fit, functional and integrative medicine for mental health. And they asked me to speak and do more of a foundational topic. And I think it's great, because I was just at the Medical Academy of Pediatric Special Needs last weekend, and there were a lot of new attendees this time. And it's really interesting to see the providers and doctors that go around, and they're just like, they're so overwhelmed. They don't know where to begin. And, it's all about laying the foundation for the switch in a mindset. So instead of, name it, blame it, tame it, we need to understand that our systems are working together. And the talk's really about just shifting the mindset of how you're actually looking at a patient, approaching a patient, evaluating a patient. And in integrative and functional medicine, you don't lose all of your psychiatry training or your medical doctor training or your nurse practitioner training. It's really, that is a foundation that we all have going into this. It's just learning how to think differently when you approach a patient. So my talk's really just the foundation for the switch on how to do that.
Wonderful. One of the things that's quite tricky, and maybe Sharon, Dr. Hausman-Cohen, I'll come to you on this one. One of the things that's tricky is there's this 17-year gap, right, between learning something new and it being adopted by medicine. And in so many of the things that are being covered here, we're sort of in that gap. Like the very first functional forum ever 10 years ago, Dr. Kelly Brogan gave a talk and sort of laid into why she felt like the monoamine hypothesis was bunk. And here we are, 10 years later, it's a little bit more known. And you're giving a talk on serotonin. How tricky is it to be in this world, be so far ahead, but to try and make content that can, wake up new doctors, but also provide value to, people who are in the field right now.
Well, I love being in this field. And actually, I'm giving a talk on beyond the serotonin hypothesis and how we can't just think about depression and anxiety as, oh, they must have problems with not enough serotonin, because what we're learning is that all chronic diseases, whether you're talking depression, anxiety, autism, dementia, or heart disease, diabetes, things that aren't really the focus of this talk, of this conference, chronic diseases are not caused by one etiology, and they're not caused by one gene. It's not sickle cell or cystic fibrosis. So that when we talk about, and I'm talking both about cognition on one day, and I'm talking about depression and anxiety the next. And in both of these talks, we're going to look at how we can go broader. How can we look at other contributing factors? We know that even using pharmacogenomics to make your choice of medications match more specifically to an individual's ability to metabolize drugs, they're still only getting in 10 weeks, so 2.5 months, 20% of people to remission in these studies. That means 80% of people are not getting fully well. And you might go, well, it takes longer. Well, even response is not where we need it to be. The response level is still at less than 40% at 10 weeks. So why is that the case? That's what we're going to look at. Well, it turns out that mental health also relates to oxidative stress, inflammation, for depression and anxiety, cortisol, growth factors, GABA, how you make the different cofactors, things like, people know MTHFR, but there are other genes. There's ones that relate to all these other cofactors of tetrahydrobiopterin and on and on and on, and transporters, and even the things that Kat mentioned of some of the other lectures, where there's going to be a talk that relates to thyroid. Well, how you can transport or convert thyroid hormone into the active form in the brain is a gene. How you, again, convert growth factors into the active form, and even your estrogen receptors, all ultimately come down not to genetic differences, but genomic differences. And so genomics is the study of the small changes in an individual's DNA that many times are not disease causing, but disease contributing. So we're going to be talking about lots of those exciting causes. And the best part about it is my area of research as the head of research for Intellex DNA has been to say, how can we take these different gene variants that are known in the literature to be associated with depression, anxiety, autism, dementia, whether it's vascular or Alzheimer's or even FTD, and then say, okay, what does the gene do? What does the gene variant do? And what can you do with diet, lifestyle, supplements, and medications to overcome that genomic thing that you can't change? You can't change your DNA, but you can respond to it. And that's the study of epigenetics, means on top of genetics. So anything we do to respond to our genetics is technically genomics and epigenetics that we're really talking about. But I'm going to make it, I know I used a lot of words and brought up a lot of topics, but I'm going to pick a couple of those for each of these topics and really make it resonate for people as to think differently. As Emily was saying, think differently about all mental health, about all health in general, but particularly mental health, and think about what are the root causes. And one of the things that's been really difficult in mental health is there have not been a lot of precise tools because of the blood-brain barrier. Many, many things that go on in the brain we can't test for in the blood. So some of the advances in sciences, including in genetics and genomics, really give us much deeper insight.
Beautiful. Yeah. So thoughtful. I guess I just want to say, I think there's a couple of interesting connections here, because I know Dr. Hausman-Cohen, Dr. Gutierrez, you're both in Austin and know each other quite well because you're working in a very similar field. And Dr. Toups and Dr. Hausman-Cohen both working on, Alzheimer's reversal and connected in that way. I guess I'd love to just hear from any of you, like, the impact of being in a room and showing up at one of these events to build this kind of connection. Like, I just wonder to what degree each of your work has been accelerated or catalyzed by the others here, and the value of having these like co-collaborating relationships for your own levels of patient care.
Yeah,
I'll speak.
Go ahead.
I think we all probably feel really passionate about our tribe, because once you decide to kind of go outside of the allopathic narrative and become more functional or integrative, to have your support of your peers doing like-minded work is critical, not only for your morale and feeling supported, but also, someone that, like I had a colleague today, I texted, that mycoplasma lecture, we learned that azithromycin and acyclovir really are not acyclovir, doxycycline really don't penetrate because it's within the cell. What are the herbs that they said on that lecture? And she sent me 5 or 6 texts with all the herbs on it. And, having that type of support, not only for information, but to lean on, but just for morale. And it's critical to doing this work.
Beautiful.
Absolutely. Nobody can learn functional medicine on their own. You have to create your tribes and your villages and your different educational groups, support groups. It's something that I've done all the way through in my path. And so I do think being able to come to conferences like this and meet people in person, go up and chat with them afterwards, and then you have a connection if you need them later, that's a huge advantage. So the community part, I'm so excited that we have it in person once again. But yeah, for me, I know so many people through the years because I love going to conferences. I love learning new things, but I love being able to meet all the people and have those connections. So I think that's essential. James, I wanted to say one thing about Sharon's work, because she mentioned the transporters and the conversion factors in the brain. And it's been interesting for me in my work and seeing her work evolve and how it informs things for me clinically. There was always some genes that were important for me to know early on, but now some of what I'm learning from the genetics testing is changing things for me. Like some people can't get enough B12 into their brain. Their transporter doesn't work right. So you think their B12 level of 800 might be great for them, but it's not. So it'll tell me with that person, I've got to push their B12 level higher if I want to help their brain, or I need to push their T3 higher because they can't convert T4 to T3 adequately to get into the brain. So the genetic stuff has been moving by leaps and bounds. And from the old days of, I've done over 100 pharmaceutical trials in my first lifetime. And we were just learning about pharmacokinetics and pharmacogenomics back then. And we're so far beyond that now with what the genetics is doing. So that's really exciting. And one more thing is I was talking about the different modules and topics within this. I still miss some. There's so many great topics here. We've got some great trauma people coming to this conference. And of course, that is one of our underlying root causes of many, many psychiatric and immune disorders. We also have, I know Dr. Patrick Hanaway is coming to talk about the gut-brain axis. And of course, the gut is another kind of root cause factor that we need to address when we're trying to help the brain. And we also have Dr. Ken Charlin speaking on Parkinson's. So we have people speaking on mitochondrial dysfunction, which mitochondrial dysfunction is such another root cause factor with all kinds of psychiatric and brain illness. And then we hamper that functioning even more because many of our psychiatric medications are known mitochondrial poisons. So they may be essential. We may need them, to relieve suffering while we try to address the root causes. But the more that people can understand that the psych meds are having these implications for the mitochondria, the nutrients, and being able to change that. So I feel like I just wanted to mention some of those aspects of so many topics that are going to be covered at this conference.
I would love to say something about the mitochondrial medicine.
Mm-hmm.
One of the things that's so important is for all of us that treat adults, we need to learn mitochondrial medicine.
Mm-hmm.
And the reason, and it sounds scary at first, but as Emily and Kat said, everyone who has studied before you is going to help you. Because I had a patient, she clearly, based on her oats testing, she was misdiagnosed, clearly had a mitochondrial problem. And literally, I found out that in the United States, there are less than 5 adult mitochondrial experts. And when I reached out to one that was at the NIH saying, this colleague is a physician, and I did a lot with her, and from what I know of mitochondrial medicine, which is a reasonable amount, but literally they all have at least an 18-month waiting list, and they're not willing to budge their waiting list. They're like, we are so swamped. So I think that the mitochondria, they're the powerhouse of the cell, but the brain, I tell my patients, it's the backup power supply. And so any organ that needs to function 24/7, like your brain, the mitochondria are super important too. And just coming and learning some of the basic things you can do. Who do you give carnitine to? Who do you give mitochondrial membrane support to? Who do you give CoQ10 to? You're going to learn a lot of tricks. But in terms of the support, the other thing that you'll find if you are newer and haven't come to this conference is coming live is great. I have come to a couple IMMH before, but they've both been virtual. So I'm really looking forward to being live, because they've been virtual for a number of years due to COVID. Yeah. And what you'll find is if you reach out, people will be sharing emails, sharing support, willing to get you trained, whether it's wanting to be trained on genomics or wanting to be trained on how you address the person with PTSD or with gut symptoms that has also, or cognition or any of those. You're going to find people willing to share their emails and also just share resources and books and other things that have helped them. So and you'll make new friends. Emily and I were both at the MAPS conference, the pediatric one, and we just felt like we were at a party with our friends. I mean, yes, we were learning wonderful coursework, but it was great at night. We were just, you're with your tribe, as you say.
Well, let me jump in with the party aspect too, because I think that Kiki has done a great job. She's, creating all kinds of social options for us at this event as well. And so there is a speaker's dinner on Friday night, but she is going to be selling tickets for people who want to attend. But unfortunately, the cost of the hotel and what they charge for the meal is quite high. But at that event, she's going to have an Irish band, and she's hoping to have people do Irish dancing there. I told her she needs to get a teacher to help us know how to do these steps, because
you can't Irish dance, Kat, already.
I took a course in Irish dancing in college, but that was so long ago. I started looking on YouTube, and of course it's quite complicated. I'm a tango dancer, Argentine tango. It's quite different, but I'm looking forward to the Irish music and dancing. And then Saturday night is another big event. That's a dinner, that everyone can attend. Again, there's going to unfortunately have to be a fee because the hotel costs are insane. But even before that, there's going to be a reception that's free in the exhibit hall for people to socialize. So I think there's, and there's yoga sessions in the morning, and there's lots of different opportunities beyond all the lectures. And of course, I want to encourage people to go to the exhibit hall as part of your learning. You can learn so much from talking to the exhibitors. I was thinking like Beyond Balance is going to be here. They make a great line of herbal antimicrobials that a lot of us use for addressing so many of the infections. Emily, we're talking about mycoplasma. I've learned many protocols and things from them and their trainings. So the exhibit hall is built in with breaks to go, but I would encourage people to make time, because the exhibitors that come and show up have something to offer us, educationally and for support.
Wonderful. Well, let me just ask the three of you. I got a juxtaposition for you in that, on one hand, if you ask people what mental health was 10 years ago, more black, they would, and further back, they would say, well, it's all about the brain. And then, in the last 10 years, we see this sort of whole body psychiatry, whole body health, thing come around. You've just spoken about it, the gut-brain axis, the mitochondria, social connections, nervous system, vagus nerve, all of these other things. It's a whole body expression. And yet, at this conference, the three of you in your own fields are all experts in one sort of area of the brain. So can we maybe just go around the horn as to why the brain is still critical, and maybe what you're going to bring from your own practice, towards this lecture that your own lectures that you can learn from. Do you want to start, Emily? We'll start chronologically in age of patient.
Yeah, good. Well, I just can't quit thinking that you forgot to really highlight the immune system. And, I think mental health has so much to do with inflammation, and that inflammation is coming from infectious and non-infectious sources. So our kids are being born with a higher body burden, a high degree of toxicity. We know that from cord blood studies. We know that from the rates of autism going up. We know that there's a new, well, it's not so new, but it's recognized as a more new phenomenon, PANS pandas. So infection to me is a huge focus. I always tell my patients, we got to find the fire. Where's the fire? Is it in the gut? Is it in the blood? Is it in the sinuses? Is it in the air you're breathing? Is it in the, allergic response that you're having? We have to find the fire and we put it out. And then we take out of your little body what doesn't need to be there, and we replace what you need to get you to the point where you can get to homeostasis and get back on that developmental trajectory. So the immune system, to me, is a huge component of mental health. And hopefully I highlight that well in my lecture.
Wonderful. Thank you. Dr. Hausman-Cohen?
So I think that what I have to say overlaps in that even if you're looking at, whether you're looking at autism or cognition or depression or anxiety or addiction or OCD, the reason you start to study integrative and functional medicine is you have to first understand detox pathways, inflammatory pathways, nutrient pathways, gut related things. And that's actually how we approach teaching, whether on any of these topics, because again, Intellex DNA covers a lot of different topics, not all in once. It depends on what your patient has going on. But whether you're looking at it for cognition or for pediatric mental health or anywhere in between, one of the things you will learn both from my talk, but all the talks over the weekend, is address foundational things to functional health and then go to the specifics for the disease. What are the specific root causes that contribute to addiction or PTSD or depression or anxiety or cognitive decline? And for anyone who wants to use genomics as that kind of a tool, we are happy to help you get started and educated. And we're even now, because one of the complaints of psychiatrists has been, I won't say it's a complaint, but concerns is, well, I don't want to do quite that much, because it's just like when Kat was first starting. So experienced functional and integrative psychiatrists, that's great. But if you're just starting off, you can just start off with just learning some of the foundational things and the genomics relating to depression and anxiety. And we have now a much shorter, simpler PDF that just focuses on that. And then when you're ready, you can study more broadly. But even if you never order genomics, a genomic report, I think you'll find that coming to this conference, not just for my lecture, but even I'm sure Kat and Emily touch upon it, we're going to talk to you about some of the root causes we've discovered in our patients, and it's just going to make you more aware of things you can try.
That's great. Kat, you want to round off on that one, and then we'll jump into something else?
A few points on that. I think the point of, yes, as you learn more and more, you need to know all these systems and how they all impact the functioning of the brain. But Mark Hyman wrote a great paper many moons ago called The Right Order of Things. I think if you Google Mark Hyman, The Right Order of Things, you'll find it. And basically, what he taught way back when I started in functional was you learn something, you incorporate it. You learn the next thing, you incorporate it. That's already putting you ahead of people that are not starting and that don't understand the connections of all these things between the brain and the body. So it can seem overwhelming for some of us that have done this for so many years and we know so many things, but we didn't know it all in the beginning. And, I look back at how much I've evolved since I first started practicing functional psychiatry, and it's quite a bit. But yes, we will be, covering all this stuff for people to start to understand. My own talk is about the work I do with reversing cognitive decline. And to reverse cognitive decline, you've got to romp through all these systems that Emily and Sharon just spoke about. So in my lecture, I apologize, it will be fast and furious, but I have a lot of content in my slides that people can refer to because it really needs to be a 3-hour talk and not a 1-hour talk, even to talk about all the factors that we look at and that are important. But so, all of this stuff, the immune, what Emily said, I want to dovetail on that. I know I call it I cubed, and it's basically infections, inflammation, and immune, because those things all feed into each other. So the role of infections in the brain is huge at all levels, from, simple psychiatric disorders compared to complex things like pandas and dementia. But it's been underappreciated. And I think that COVID has now shown the world the importance of what a virus can do to the brain. We have young people with brain fog, dementia, cognitive dysfunction. We have people going into frank dementia, because of COVID infections and sometimes COVID vaccines. And so, the role of the infections is huge. And I feel like we need so much more. I write to IFM every year when they want to know what topic should we have for next year's conference. I always write infections. We need, more help and more research and more input in how to manage these infections. Also the hormones. I think, I think the things in my world of cognitive decline that people are missing are the impact of infections, toxins, and lack of hormones. Some of the other stuff, the metabolic stuff is well known, the diabetes, the lipids, those kind of things, but the vascular issues, but infections, toxins, lack of hormones, and there should be talks on all of that here at the
Okay, I just want to double click on that, because I would say, one of the reasons why the work you're doing is so tricky to do, to reverse, cognitive decline, is that in order to do it, you have to be good at addressing all of those things, depending on what comes up on the intake. And so, while this is a mental health conference, I think that any practitioner, working with any sort of chronic issues is going to learn a lot from a lecture like yours, because ultimately, in order to reverse cognitive decline, you have to be good at hormones, you have to be good at infections, you have to be good at toxins, you have to be good at all these different levels, the metabolic health as well. And so I think there's a lot to learn. And
but let's put that in perspective. You don't have to be good, you just have to understand the importance of it. You have to test for it, assess for it, and then have a community of people that you can refer to. Like maybe, I've learned to work with hormones because I couldn't find people in my community doing it the way I thought it needed to be done. But it would be great if you had somebody really excellent that you could send your hormone patients to. If so it comes back to our sense of needing these meetings and developing our tribe and our community. So you don't have to start by being an expert in all those things, but understanding the importance of it and how it relates to the brain. And anything I talk about for reversing dementia is important for pandas. Same stuff, right? It's the same.
Yeah. Well, in the shift of just understanding the pathophysiology of brain inflammation, like immune-induced, microglial glutamate excitotoxicity is a huge, huge thing in mental health. And if you don't kind of zoom back and try to look at the pathophysiology of how the body is influencing the brain, you're going to just miss that very fundamental concept. So even if you don't know exactly what level of progesterone to prescribe right at first, just coming to the conference and just trying to be open and saying, hey, there might be some different, there's a different way to look at mental health. There's a different way to look at how systems biology is influencing the brain. And I promise you too, it breaks. If you don't know anyone, you can sit next to anyone at a table. And I actually make this every conference I ever go to. I sit down next to somebody that I don't know, so I can strike up with a conversation and get to know them. And conferences like this, it is such a community of people that want to support each other and that are open to getting to know each other. So I wanted to make sure I said that, because I don't want people to be intimidated. I don't know anybody here. We've got all these famous, great speakers. Not that I'm one of them, but we've got some really big speakers coming up. And, I just say you come and be open to learning and be open to that shift that we all had to go through when we started doing this work.
Absolutely.
And it is a shift, right, Emily, the shift from even you start and, you think, okay, green pharmacy, right? Oh, I can give some herbs and nutrients instead of meds, but no, it's a complete shift.
That's right.
So, how do we address the root cause underlying factors? And so all of us need help to sort of undo that medical indoctrination that we've had. Like, okay, you just manage this disease. No, we want to cure this disease. We don't want to just manage it, right? So this is it's very exciting work, and it's just so important. And the more you learn and dig into this and are able to help people reverse things that are supposed to be chronic and never get better, it's the most exciting work ever. And I think psychiatry and mental health, they're the ultimate functional medicine physicians, right? Because a lot of functional medicine physicians they want to hand off their parts of the mood and the brain and the trauma, to people. So functional medicine, I think, is just psychiatric functional medicine is, to me, the ultimate, being able to connect all the systems together.
I want to just share like an example from my world of where, the work that all of you are doing, like really the rubber hits the road and the sort of the message exponentially increases. So I was speaking to a psychologist recently who has a big psychology practice in Philadelphia, and her son developed, very acute, very strange mental health symptoms. And she didn't know what to do. She had a toolbox of talk therapy and that's about it, and couldn't really make any headway. Her father, the boy's grandfather, was a physician, and he was sort of, what can we do? And banging his head against the wall, and no progress. One referral to a functional medicine physician. No surprise to you, Dr. Gutierrez. I'm sure you're thinking about it already, but it's PANS and it's an infection. They deal with it. The kid is back to normal in a month. And then just imagine what it's like to practice mental health, or to look at all of your patients that are coming in day after day for talk therapy when you've just had that experience. And what you've seen in that moment is now 40 therapists that all refer to the functional medicine, all of them wanting to learn, more about it because they've seen this dramatic change. And I think so many times in our world, there's an experience like that changes you forever, where you just can't go back to practicing the way that you had. And either we have to wait for something traumatic and something like that to happen to ourselves or a family member to shift, or this is like available to everyone right now to come and participate in. I just thought that was such a cool segment, because it speaks to the sort of elegance of the root cause approach. And once you've seen it in action, it's hard to dismiss it.
And nobody is more inclined to change or to learn, and unless their child or someone that they love is suffering. They're welcome. Sometimes we need that pain to make the shift. We need that trauma to be open, to go through something hard to change. And it's complex. Pandas and PANS is very complex. I have to give a shout to Sharon, because there's a gene on her tool that I find to be really helpful in these kids. It's called the mannose binding lectin 2. Sharon, are you going to be talking about that one at all?
I don't think at this conference, because it's not so much depression and anxiety. It relates more to OCD and to pandas, but it is an interesting gene because it makes it so you can't fight off infections as well, including yeast, but also spirochetes like Lyme disease and strep and all kinds of things. So it is an interesting one, but I'm happy to talk about immune at the next conference, and the immune and inflammatory, because even when we were talking about infections, sometimes the infection hasn't crossed across the blood-brain barrier, because as you know, most infections, that's really, really serious when you get a meningitis or an encephalitis. But even an infection in your gut, an infection in your heart, like if you have a heart attack and you have to have you have surgeries or anything, or you have an infection, tissue damage in one part of the body can trigger the release of things like IL-6 and cause inflammation that crosses the blood-brain barrier. So what happens is, I feel like the reason I care so much about mental health is children, adults, people of all ages are being labeled. This kid has ADHD, this person has depression. And mental health has a lot of stigmata where it's like, oh, it must be their fault. They're not being able to see what's good in life, or they're just nervous. And when you can then say, wait a second, let's understand it and fix it, it's so rewarding, because all of a sudden this child can go to college, or this person can go to work without having to have these labels on them. And I'm going to call a shout out to your research work, Emily. So one of the things that has really happened in the United States is our diet is much less rich in zinc. It's less rich in some of the B vitamins and things. And so people aren't making enough serotonin, and like zinc's a big cofactor. then people don't make enough GABA. And if you don't make enough of these different these neurotransmitters, that can be a trigger for anxiety and depression. And Emily saw a need in the pediatric community of there not being any capsules designed for pediatric use, that it helps people make more serotonin, that can help you to like, and she has different things, but she founded a company that's neuronutrients, and she's taken the genomics and said, even if you don't have genomics, let's look at some of the nutritional root causes, hence the name neuronutrients, and make it so before we try medications, we can try using saffron, which can increase serotonin synthesis. We can try using, the cofactors, the vitamin D, zinc, et cetera. And so I feel like as a collective, we can make it so that people have simple tools in their toolbox. There was a study showing that children with ADHD can lower their medicine more than 25% just by having adequate zinc. Well, a few decades ago, a generation ago, people ate liver and onions, even though I think it's kind of disgusting.
Well, we tried not to at my house.
Right, because now liver is so toxic because it has all the pesticides in it. But not having liver, not having that was the big zinc food. So now our children need more zinc. And so you're going to learn things, even if you're a beginner, if you do nothing else but give your patients with depression some of the foundational nutrients to make more serotonin, the patients with anxiety, the ability to make more GABA, things to lower glutamate. Even if you just lower those and raise those, you're going to start to recognize the patterns. Oh, this person's kind of that high glutamate person. They're biting their nails. They're, picking at things.
Their hair.
So you're going to learn lots of great tricks that just on symptoms will give you a heads up compared to a psychiatrist or family physician.
Let's take that to the gut-brain axis as well. One of my early patients was institutionalized with schizophrenia, and in short order, I was able to help her get out of the institution. And all I was able to do in the beginning was, it took a half hour or more of arguing with the nutrition person at her facility, but I put her on a gluten-free diet. And I put her on some high-dose probiotics like VSL3, because I knew there was something going on with her gut that was impacting her brain from her history. And that alone, this woman went from, in the first interview, being completely agitated, I'm scared, I'm a good person, I'm a Catholic, flapping, couldn't stop, perseverating. And this, 6 weeks later, she sat with me for 2 hours. She was calm. She only started to escalate once. And I said, oh, let's go weigh you, just to move her around. Like, it was night and day. And that was just some gut interventions, right, with her diet and her probiotics. And she literally was able to get out of the long-term care facility. So the kind of things that can happen, I mean, you can cure major depression of somebody that's suicidal and crying all day in fairly short order for some people by changing their diets and giving them some key nutrients. And then you can watch them relapse when they cheat on their diet during the holidays.
Well, what a paradigm shift. It would be my hope that all mental health providers, as part of their initial assessment, does a fecal calprotectin to look at intestinal inflammation. Why isn't that standard of care? Because the gut and the brain are so connected. And just knowing if there's a ton of inflammation in the gut, that's such a great place to start.
Yeah, exactly.
Well, you did mention it earlier, Kat, but I've got a little commercial for us here about the event that we're going to be putting on as part of it. So on the Friday night of the event, 100 practitioners will be able to enjoy the new improved Vegas Fest. We did the first ever one at IFM, but my feeling about this is that if you're going to be in the business of participatory medicine, giving patients an opportunity to participate is a great one and is a great starting point. And one of the things that I've seen from functional medicine clinics is that there's so many things that we can do with diet and lifestyle and supplements. And if and only if all of those things sort of go through and we still don't have the resolution we want, then we start to look at nervous system stuff. And what I guess I'm showcasing through this is that what if we could start at the very beginning, even before you got into a one-on-one relationship with working on the nervous system. So here's a little video of what you can expect.
Ladies and gentlemen, welcome to Vegas Fest.
of Zilker Park there, you Austinites. There was a little bit of Zilker Park in there. So yeah, so on Friday night, we're going to be doing the Vegas Fest. The first time we did it was actually in Las Vegas, but now we've done it a number of times since and learned a lot through it. You know, really the purpose of this was to, you know, to find a way to make it easy for practitioners to give their patients an opportunity to tone their vagus nerve and to regulate their nervous system early on in the process. And one of the things I'm really excited about is that this can be done, you know, by any practitioner of any license at any stage of the healing process. And one of the things I'm going to be talking about at the Vegas Fest is since then started to realize, like, you know, from the very beginning, like before you see a patient, right through maybe the pre-education process, then you're making it to your appointments, and then maybe you're putting people into an ongoing program in your practice. Nervous system regulation, you know, can help people make good decisions about themselves, can help them get into a habit of doing things every day that can be healthy. And once you have that inner momentum with patients that they're doing things, then obviously you can put all kinds of individualized medicine on top of it. But one of the things that I came to recognize is that all of individualized medicine is sort of like a fairy tale if people aren't like ready to do new things. And I think there's a lot of safety that comes in groups and connecting and being part of a group of people who want the same thing. Obviously, at a professional level, all of you guys have found that through conferences and so these areas. But I'm continuing on the train of trying to, you know, make group-based care a part of the standard of care, because I believe that there's a lot of nervous system and co-regulation things that can really help with that. So, Kat, I know you've been before. Maybe I'm hoping that you know, some of you will have a chance to do it. What are the three of your thoughts on this sort of emerging area of mental health?
What do we wear? What do we wear to Vegas Fest? First question.
Lululemon. No, you can wear whatever you want. That's part of it. If you want just not too short a skirt, if you want to do cat cow.
That's true.
Fantastic.
James, do people, are they going to sign up? You can only handle a limited number.
Yeah, we got 100. We'll sign, you know, people up probably on the first day, and I'll be there.
Okay.
You can come and find me at the booth. We'll be doing it. We are going to have a little snack before. We realized everyone got a little bit hangry in Vegas, so we have a little snack so that people can put off their hunger for a bit. But yeah, we'd welcome everyone to come and check it out. And look, the whole point of it is really that you would experience it and then want to take it back into your community. And one of the cool things this summer, we have a Facebook group for people who are executing it. But we have practitioners now, even in September, while the weather's still good, putting on these kind of events and using it as a way to give the gift of nervous system regulation to people in their community. And then, you know, they end up coming into their practices, which is really cool. And I guess for the last thing that I want to share, let's just go in.
Can I say, from participating in that, and, you know, I utilize so many of these practices personally and teach them to my patients, but I still really enjoyed how it was orchestrated, and you went to different stations and experienced the tools. And as you said, even with the group, the benefit of the shared energy between people in the group was lovely. So I think it's another foundational root cause factor for people. And many of us that work with people that have multiple chemical sensitivity, they're allergic to everything, and they have so much fear because everything's making them sick. You cannot help those patients until you can help them learn to settle their nervous system down, right? You cannot heal when you're in that fight or flight mode. So it's another essential root cause. So I'm so glad you're bringing it again to, you know, all these meetings and bringing it to this one, James. Thank you.
Yeah, it's fun. It's hopefully it's fun. It's engaging. It's practical. You're learning through doing, and I'm excited to be doing that. Well, look, I'll just finish off by sharing, you know, some of the speakers here. Maybe all of you guys, if you have, you know, a couple of speakers that you're interested in checking out. I mean, look, like the MAPS conference has 12,000 people that attend on psychedelics. So I'm glad to have Scott Shannon sharing a little bit of that, because that's obviously something that's, you know, large in society. Asim Malhotra is a recent addition. I'm excited to see him. Felice Gersh was meant to be on this evening. She's in Istanbul teaching, but there's a sort of a hormonal side to all of this. Any other highlights from any of you as I go through all the speakers here? Present company accepted.
some of you may not know Nancy O'Hara. Nancy O'Hara is one of the world experts on pandas and PANS. So when you're talking about immune and infection response, she's written a book for practitioners as well as a book for parents for, again, people who all of a sudden get sick with mental health issues of the OCD, all kinds of other changes. So I think this is the first time that she's speaking at IMMH. I think people will really, she's a great speaker. Arwen Podesta, as many of you know, because she's obviously been involved in IMMH for a long time, is one of the leaders on addiction medicine. And again, I was excited that this year that they're tackling a couple lectures on the topic of PTSD, because I think that's a tough group of people to work with. And so I know a couple of our speakers are touching upon that.
And we can always learn a ton from Dr. Shaw. He is the expert in interpreting organic acids. Every time I've listened to one of his lectures, I've learned something new. And I've probably been through 10 or 15 hours of lecture from him. So that's exciting to see that he's going to be there.
I mean, I think the real drawback is that there's concomitant sessions for most of it, and you want to go to both of them. I was telling James before we started, I've gone to so many conferences for so many years, and sometimes I go to a conference and I've kind of heard it all, and I don't get that excited about going to the talks, and I'm going for the networking. But at this one, there are so many talks that I'm very excited to go to. We just have, cutting edge speakers, cutting edge topics. I think the amount of knowledge and wisdom of people that are going to be speaking at this conference is phenomenal. And one thing that I know that at least for 30 days after, when they process the video recordings, I think everybody, whether they're virtual or in person, are going to get access to the recordings. It may just be for 30 days. I'm not sure on that, but you will have the opportunity to go back and listen to topics that you were interested in, you couldn't go to. And I'm not sure also how that's going to impact the CME. There is a lot of CME that's gotten approved for this conference. And I don't know yet if you can say you go to one track, can you listen to the other one offline and then apply for the CME? I'm not sure about that yet, but yeah. But people will be getting a copy of the recordings for at least for a certain amount of time.
Awesome. Well, look, I want to just say, I want to thank each of you individually for, the decades of work that you have put into this field individually. I remember, with each of you actually have like an early memory. Kat, I remember coming to Sunja's house in like 2015 for your East Bay meeting. Yep. Sharon, I remember you speaking like 2017 at the Jeff Bland's PLMI thing with the early intellects DNA, and Emily, just hearing all about your great work and connecting with on the pediatric side with some actually lawyers who were in Austin and had recommended your services even back then in the autism world. I'm so grateful. I feel like that there's so many different forms of wealth in this world. And I feel like the wealth that I built up in meeting so many experts in so many ways, I feel grateful that I and my family is all healthy, and I've taken a lot of the learnings from sitting in these conferences for 20 years and applied them to myself. But I just know that I get to spend time with the sort of leaders of this new school and new paradigm of medicine that is emerging. And, I think more than ever, mental health is right at the center of what's needed in society and policy and awareness, and, even the connections between the environment. It's becoming more and more clear, and sort of people are getting, getting some momentum to the fact that this is, a national emergency of mental health, basically, like with the first time the life expectancy has gone down of any major country ever. And, I'm grateful for all of your pioneering work. I'm excited to see you there. I'm going to be there with the Functional Forum cameras. We're going to be making a show actually for the December forum. We're going to be making a show there. So I'm going to be doing lots of interviews. So if you're watching this, please come and find me. I've actually had a couple of people on X say already that they're sold as a result of today, and they're coming. So I'm excited to see. I know that there's 500 people who have already signed up. I know there's only a few. I know it's going to hit capacity at some point. So get your tickets, get signed up. You can see all of us there. Thank you all for being here. being available for this evening's show, and look forward to seeing you in just about a month's time. And thanks everyone for listening at home. I hope that you can participate. If you can't participate, we'll see you back here next month. So the first Monday in October, I'll be actually reporting from the Independent National Convention that is actually happening next week in Denver. We got Zach Bush, we've got a number of other speakers there. If you are a little burned out on the current state of American politics and are looking for a new vision towards, truly independent work, I'm really excited to be showcasing, some of the speakers, some of the thought process there. I think it definitely aligns with the sort of independence that was necessary for most practitioners in our space to forge forward and build this new paradigm of health. So I'll be there next week, and I'll be reporting in October on that conference. And thanks so much for tuning in. This has been the Functional Forum. We'll see you all very soon. Thanks for participating.